Hello everyone, welcome back to the channel. Did you know that hand hygiene is the single most effective way to prevent the spread of infections in healthcare? According to the WHO, about 50% of healthcare-associated infections can be avoided by proper hand hygiene. That is why hand hygiene is one of the most powerful tools we have to keep patients, colleagues, and the community safe. But it is not just about washing hands, it's about knowing when to do so. Today, we are breaking down the 5 moments of hand hygiene according to the World Health Organization and why they matter for patient safety. Moment 1. Before touching a patient. Even if your hands look clean, they can still carry invisible germs. Performing hand hygiene at this moment protect the patient from whatsoever microbes you might have picked up along the way. Hence, performing hand hygiene before patient contact is very much important. Moment 2. Before a clean or aseptic procedure. Think of it as a safeguard before anything invasive. This can include inserting an IV line, performing catheterization, before cannulation, before preparing an injection, before dressing a wound, or before collecting blood in the laboratory. Performing hand hygiene at this point prevents introducing harmful pathogens into vulnerable areas such as an injection site or an open wound. Moment 3. After body fluid exposure. Whether you are handling blood, secretion, contaminated surfaces, your hands immediately, even if you wore gloves in the process. Remember that gloves do not replace hand hygiene, and when you perform hand hygiene at this moment, it prevents you from picking up microorganisms from these contaminated surfaces or secretions and disseminating them onto other surfaces or other patients in the ward or in the hospital. Moment 4. After touching a patient. Performing hand hygiene after touching a patient protects you and the wider healthcare community from anything you might have picked up from touching the patient or from direct patient contact. Hence, hand hygiene is paramount after touching a patient. The last moment is moment 5. After touching a patient's surrounding, even if you were not in direct contact with a patient, the patient's surrounding could be something like patient's bed, call button, and charts. All of this environment can harbor microorganisms. Cleaning your hands at this point prevents you from picking up microorganisms from the patient's environment and disseminating them across the hospital ward, hence spreading infections unknowingly. The WHO has recommended 2 methods of hand hygiene. The first method, which is alcohol-based hand rub. It is the preferred method of hand hygiene when their hands are not visibly dirty. However, the alcohol content of the hand rub must be between 60–80%, and usually it takes about 20 to 30 seconds for proper application. The second method of hand hygiene recommended by the WHO is hand washing. Is the recommended method when the hands are visibly dirty, contaminated with blood, body fluid, or after using the toilet. Use clean running water and plain soap or antimicrobial soap. Usually the process takes about 30 to 60 seconds for it to be completed. In this video, we have seen that when you practice proper hand hygiene according to the WHO, you are not just practicing good hygiene, you are actively protecting lives. Therefore, let's go on. Protect lives by understanding our 5 moments of hand hygiene and practicing them every day. Thank you so much.